A breastfeeding and peer support worker volunteers to support mums that have just had their babies. We offer guidance and give them advice on breastfeeding issues that they may come across. We can support them. Some support workers do it on the ward, some of us do it at home over the phone, can offer home visits, and we also help run little breastfeeding groups in a few of the towns.
Sometimes, you know, all a mum needs is someone to go, do you know what, you're doing a great job. I know it's really tough, but you're doing a great job. I know you're knackered, but it's fine, you're doing great.
I wanted to volunteer with NHS because my ultimate aim is to become a midwife myself, and I hope to do my training hopefully next year. And I know that volunteering is really looked as a positive thing to do within getting into university. They really sort of value the volunteers, and I thought, right, what can I do? And I know through myself that I valued the support I had when I breastfed my own children, and I thought that would be really good to get into. So I've now been doing that for about 2 years.
I have 3 children, and I had 3 very different breastfeeding experiences. At the time, there wasn't a great deal of support for ladies out there. Unless you had the money to pay to go and see a lactation consultant. I realised that definitely something I wanted to pursue, and someone told me about the peer supporters, and I got in touch with someone who put me on the path, and here I am kind of doing it to help give back to ladies who haven't, you know, just need a wee bit extra help.
The impact that the breastfeeding volunteers have on mums is huge. It's a great comfort for mums on the ward to know there's somebody there, a visible presence, somebody that comes round to see them, just ask how they're getting on, helps with any problems that they have got. And then it's also a comfort to know that they're going to be there in community, so when they go home, any breastfeeding problems can be followed up by the BiBS breastfeeding supporters.
It's just such a lovely service to have, you know, contacting mums on a regular basis, and then when you're getting that message back that even 7-8 weeks down the line that they're finally getting to grips with things, and they're so grateful for that support, because if they didn't, they probably would have given up.
To have a mum come into a group who has been crying, you know, thinking, I can't do this is not working, and then to see them a couple of months later and them to go, do you know what, it's amazing, it's finally sorted, and thanks so much, you know, just getting that recognition that just that wee bit of support is helping people out there. It's really gratifying.
We know that there's going to be somebody there to help mums. If we're busy, we're tied up with other things, breastfeeding is a huge issue and it can be time consuming. So if staff know there's somebody there to help mums, it's a weight off our mind to know that they're getting the help and support that they need.
And I'm so proud of the fact that we all give our time to our local community and giving back, and just seeing the results of that I think are extraordinary. I think, you know, we've done an awesome job in the Borders helping mums locally.